Devi Prasad Shetty was born on 8 May 1953 in Karnataka, India. He is an Indian cardiac surgeon and entrepreneur. He is chairman and founder of Narayana Health, a chain of 21 medical centers in India. He has performed over 15,000 heart operations. In 2004, he was awarded the Padma Shri, the fourth highest civilian award, followed by the Padma Bhushan in 2012, the third highest civilian award by the Government of India for his contribution to the field of affordable health care. He is the eighth among 9 children of his parents. He decided to become a heart surgeon when he was in 5th grade. He was inspired when he learned that Dr. Christiaan Barnard, a South African surgeon who had just performed the world's first heart transplant, after completing his MBBS in 1979 and postgraduate work in general surgery from Kasturba Medical College, Mangalore. He was trained in cardiac surgery at the Guy's Hospital in the United Kingdom. He returned to India in 1989 and initially worked at B.M. Birla Hospital in Kolkata. He successfully performed the first neonatal heart surgery in the country in 1992 on a 9-day-old baby named Ronnie. In Kolkata, he operated on Mother Teresa after she had a heart attack and subsequently served as a personal physician. After some time, he moved to Bangalore and started the Manipal Heart Foundation at Manipal Hospitals, Bangalore. Financial contribution for the construction of the hospital was provided by Shetty's father-in-law. In 2001, Shetty founded Narayana Health multi-specialty hospital in Boma Sandra on the outskirts of Bangalore. He believes that the cost of healthcare can be reduced by 50% in the next 5 to 10 years if hospitals adopt the idea of economies of scale. Apart from cardiac surgery, NH also has cardiology, neurosurgery, pediatric surgery, hematology and transplant services, and nephrology among various others. The heart hospital is the largest in the world with 1,000 beds, performing over 30 major heart surgeries a day. The land on which the health city was built was previously marshland, which was reclaimed for this purpose. The health city intends to cater to 15,000 outpatients every day. In August 2012, Shetty announced an agreement with Trimedex, a subsidiary of Ascension Health, to create a joint venture for a chain of hospitals in India. In the past, Narayana Health has collaborated with Ascension Health to set up a healthcare city in the Cayman Islands, planned to eventually have 2,000 beds. Shetty also founded Rabindranath Tagore International Institute of Cardiac Sciences in Kolkata and signed a memorandum of understanding with the Karnataka government to build 5,000-bed specialty hospital near Bangalore International Airport. His company signed a MOU with the government of Gujarat to set up a 5,000-bed hospital at Ahmedabad. He was elected as the chief patron of Indian Association of Clinical Cardiologists during the annual scientific session at Bangalore. He was a part of the 7-member panel of Board of Governors, which replaced the MCI and served for a period of 1 year before it was further reconstituted. Shetty aims for his hospitals to use economies of scale to allow them to complete heart surgeries at a lower cost than in the United States. In 2009, the Wall Street Journal newspaper described him as the Henry Ford of heart surgery. 6 additional hospitals were subsequently planned on the Narayana Health model at several cities in India, with plans to expand to 30,000 beds with hospitals in India, Africa and other countries in Asia. Shetty aims to tame costs with such measures as buying cheaper scraps and using cross ventilation instead of air conditioning. That has cut the price of coronary bypass surgery to 95,000 rupees, half of what it was 20 years ago. In 2013, he aimed to get the price down to $800 within a decade. The same procedure costs $206,385 at Ohio's Cleveland Clinic. He has also eliminated many pre-ops testing and innovated in patient care such as conducting and training patients' family members to administer after surgical care. Surgeons in his hospitals perform 30 to 35 surgeries a day compared to 1 or 2 in a US hospital. His hospitals also provide substantial free care, especially for poor children. He performs free surgery for the poor. In many parts of rural northern India, the poor refer to Dr. Shetty as Bypasswale Babu, that is the saint who grants bypasses. Also very much like the saints of yore, no one who dreams of a bypass and comes to his hospital or ashram lives without a bypass. Shetty and his family have a 75% stake in Narayana Hrudayala, which he plans to preserve. Shetty has also pioneered low-cost diagnostic services. Yashasvini is a low-cost health insurance scheme designed by Shetty and the government of Karnataka for the poor farmers of the state, with 4 million people currently covered. His awards and recognition are as follows: Padma Bhushan Award for Medicine in 2012, Karnataka Ratna Award in 2001, Entrepreneur of the Year at ET Awards in 2012, the Economist Innovation Awards for the business process field, Honorary Degree University of Minnesota in 2011, Honorary Degree Indian Institute of Technology Madras in 2014, Swab Foundations Award in 2005, Padma Shri Award for Medicine in 2004, Dr. B.C. Roy Award in 2003, Sir M. Visvesvaraya Memorial Award in 2003, Ernst & Young Entrepreneur of the Year Life Sciences in 2012, Ernst & Young Entrepreneur of the Year Startup in 2003, Rajya Sabha Award in 2002, Indian of the Year in Public Sector chosen by CNN IBN for 2012, taken from Wikipedia. Thanks for watching.